For the next podcast, I'm happy to bring Aditi Subramanian from FLEXcon, and she is the Strategic Business Unit Manager for the healthcare division of FLEXcon. So in this episode, we talk about an exciting new product called OMNI-WAVE that FLEXcon has launched, and go into the benefits, the applications, market drivers, some test standards, and then Aditi shares the future roadmap of FLEXcon's aspirations in the healthcare space. So this is if healthcare and stick-to-skin adhesive and hydrogel-free biosensing technology is of interest, then this is absolutely the podcast for you. So without further ado, bringing you Aditi from FLEXcon. Thank you. So welcome everyone to the next episode or the upcoming episode here of the Better Product Solutions podcast. I'm Steve Davis, as you know, and I'm really happy to have Aditi Subramanian from FLEXcon on the podcast. And so her official title, I'll make sure I got this written down here, Strategic Business Unit Manager for the healthcare side of FLEXcon, which is, I'll say, an emerging side of FLEXcon. That's pretty exciting. And so Aditi, welcome to this Better Product Solutions podcast, which is
having me.
yours truly. But so I'll give you the softball question in the beginning. If you could tell us about yourself and your role at FLEXcon, kind of how you find yourself at FLEXcon and what you're doing at FLEXcon.
Sure, absolutely. So a little background about me, biomedical engineering to start. So my roles have always kind of been in the medical area. I started in adhesives and then moved more into med device, creating new products from blood pressure monitoring to endoscopy, really just making sure to understand the why, right? Trying to solve the problems for the physicians or the patients. And then I moved into FLEXcon, I think about 12 years after med device, to get really into the component side. So I'm the business unit manager for FLEXcon for healthcare, and I was really hired to kind of essentially grow the healthcare business, right? FLEXcon has been growing in healthcare kind of unbeknownst to themselves for a while. So I was kind of brought in to build some rigor, put some structure, arm our sales team to be able to sell technically, and really just focus on healthcare because that's where we see the future of FLEXcon going.
Awesome. And it's interesting to hear you call it the component side. So I'm obviously, me being in the converter channel, FLEXcon being a supplier, I guess, we are on the component side, right?
Yeah.
I mean, we're not med device companies, we're on the component side. So I have to imagine that 12 years on the device side is a nice perspective coming into FLEXcon to kind of lead that effort.
For sure. And I think it's one of the cooler sides because, innovation can happen in so many different aspects. But when you're in med device, you're trying to handle so much and submit it to the FDA that if you can get innovative components, innovative materials, different areas, you can only bring that into a better product. So.
Yeah, I have more questions on that later, but I'll pause there just on the compliance side, which just something popped into my head, but I'm going to reserve that one. So kind of the exciting news that I wanted to let you speak about is the OMNI-WAVE product. So it's a product that you guys have been doing a lot of effort. I've heard of it in the past, but I think it seems to get more and more prime time, and I think it's really prime time now. So what can you tell me more about the OMNI-WAVE product?
Yeah, it's awesome. I'm so excited to even be part of this. So, FLEXcon has been working on OMNI-WAVE and really invested in OMNI-WAVE for, a decade now, a little bit more than a decade, and it's really come into various iterations. But what we actually launched in November, and it's essentially basically a material that's an alternative to a hydrogel. So if you're familiar with hydrogels at all, I mean, they're great. They've been on the market for about 50 years, and there's pros for them, but there's also cons, right? So with hydrogels, they're essentially a water-based material that can cause skin sensitivity in patients, right? So anything from small rashes to very big boils. And so there's some adverse effects that come with hydrogels. They're just kind of the incumbent on the market. OMNI-WAVE kind of seeks to provide the alternative to that. So with OMNI-WAVE, you're getting a lot of great features. You're going to get, right, the non-water based. So OMNI-WAVE essentially is not a water based materials, so you don't have to worry about it drying out. As long as OmniWave is on the body, you're going to be able to pull a signal out of it, essentially, which does not happen with hydrogels. As soon as you open a hydrogel pack, or electrodes would be a similar way to consider it, and as soon as you open that, the clock starts ticking on, is it going to work? Are you going to get a signal? Is it going to stick to the body? Those are not issues you're going to have with OmniWave. Additionally, right, with that water moisture keeping it in, you have expensive barrier packaging that you need, aluminum barrier packaging to keep that water in. You don't need that with OmniWave. And then also there's just values to converting. So hydrogels essentially are like 30 to 50 mils thick. So they're really thick, gooey substances. So when you think about converting that, right, there's a lot of issues that come with die cutting, with processing the hydrogel to make sure you can convert it correctly. And then just foot rolls, and all that is kind of handled with OmniWave because it is 1 to 2 mils thick. It's not water-based, so it's just easier to convert, easier to package, and a longer shelf life. So you get all that with the patient comfort and ease and compliance there.
Yeah, and before I stepped in here to, for us to do this recording, I walked into one of our application engineers' offices.
Yeah.
And I said, hey, and we talked a little bit about this product, because in the past, we do not convert hydrogel, and it was because of the complexity of the converting process. So we have no bid hydrogel converting in the past. And this product was exciting and is exciting for us because of the convertibility. And you look at your data sheet, you guys don't talk as much about the convertibility and like your value proposition on the product, but I will say that there's, from a converter perspective, it's more converting friendly, and particularly the die cutting and the handling.
Yeah, absolutely. That's the coolest thing too, is we really want to work to quantify that, but everyone's setup is a little different. So what we're trying to do is hear from each customer's experience. So for example, one of our customers was saying that they use hydrogels in 300-foot rolls, so they have to change out the roll every 8 minutes. OmniWave comes in 3,000-foot rolls. So it's stuff that you don't even realize that we should be able to put a quantity and a number to and a value to, that we're working to kind of get those numbers out.
And not to get too technical here, but Z-axis versus X-axis on signaling and catching signaling. Can you speak a little bit about that?
Yeah, so I will tell you, I'm not an electrical engineer to start, but I did get this snippet from some of our electrical engineers. So basically, OmniWave is XYZ directional, and it's an isotropic adhesive, so it doesn't have to bridge. It doesn't bridge across multiple electrodes. Often, I believe hydrogels are just XY, and so OmniWave, you get that Z directional as well.
And I guess we're kind of answering this, but the next question was like, okay, you're a brand owner, you're a healthcare OEM, you're looking at specifying a product in a new product design that obviously needs, an electrode on it. What what are some other ancillary benefits, or did you name them all from their perspective of what they why the product's differentiating from hydrogel?
So I think in med device, the way we always used to look at it is like, is it going to save the patient comfort or help with compliance? So is it going to help the patient in some way? Is it going to save you money, or is it going to save you time? And I think I kind of spoke about that, right? But from the patient comfort care side, right, OmniWave is, you don't get those skin rashes and the skin associated effects with that. From the money side, right, that's the converting, also the out of pack shelf life, 2 years. And then the time comes to just the converting, being able to process hydrogen, or being able to process OmniWave a little bit easier, not having to freeze OmniWave, right? Essentially, people sometimes freeze hydrogels before they convert them. So I think it all comes into that. You can bucket it into patient comforting care, money, and time, and it kind of hits the box on all of them.
Yep. And the applications, I mean, obviously there's the, in-hospital healthcare space, but then there's also, I mean, what did I hear the other day? The worried well. Is someone categorized the worried well? These are people that are buying more and more wellness products, even though they're completely healthy individuals. They're, they want a continuous glucose monitor to see what they're eating, and they just want more, they want more wellness information to supplement their already probably very, very good health habits, right?
Yeah.
So can you speak to the markets that you're kind of focusing on trying to penetrate?
Yeah, absolutely. So the way we bucket them are wearables, right? So that could be right more in the consumer space, the worried well, or people that just want to know about, how their heart's doing, what are the rates or whatnot. And then there's also the aspect of med device, which, more with digitization and being able to send patients home with devices that the doctor can then come in and look at the data. So we kind of classify as that as the wearables area, whether it's consumer or more in the medical hospital space. And then, of course, electrodes, right? Anything that needs an electrode to pick up an ECG, EKG kind of signal, OmniWave is a perfect substitute for that as well. So,
And what's kind of driving it? I know in terms of getting adoption on the
mhm,
product, I know that, a lot of our healthcare customers, like, change control is a painful thing to try to make any type of change. So
mhm.
what's driving it? Is there any particular driver that's going to get the adoption in there in terms of either changing from the existing hydrogel, or are you targeting more new applications and getting specified in and then on new product introduction?
Yeah, so I think a bit of both, right? Like we recognize if you consider the diffusion of innovation curve, you're always going to have those fast followers and then the laggards, right? So I think because electrodes have kind of been around forever, they're going to be the slower ones to move along. But we are focusing really on the innovative sides, right? The people that are considering new devices, essentially anything. OmniWave for itself is more of a reliable signal than hydrogels because it's not going to dry out. So if you want to wear a device, it's just of a more reliable piece of material to put in the device to get the data you need. So I think that's what driving it is more of the reliability of getting that consistent signal.
And you on the topic of consistent, in terms of, I guess maybe this is peeking under the hood within FlexCon, but what type of testing, how are you guys, I guess, qualifying that the product's going to be repeatable? What type of in process or product testing that did you do in the beginning of, I'll say, the specification of your product? What type of testing is it going through?
Yeah, absolutely. So we have invested so much from an AMI standpoint, from a clinical standpoint, from a internal testing, right, physical adhesive properties standpoint. So I'll speak to kind of all of that, just because we truly believe in this product, and the more data we can give to our customers to prove it out is what we can do, right? So OmniWave passes AMI EC12 testing. It's also ISO 10993-10 for sensitization and irritation. It's REACH and RoHS compliant. We've done so much internal testing for physical properties, adhesive properties, electrical properties, and then the massive amount of clinical testing that we've done and clinical studies we've done to really prove out, right, this association with hydrogel skin averse reactions, right? We've invested with UMass, with UConn to really prove out the clinical aspect as well. So all that to say, it's been approved it's a approved component in 510K devices. It's already kind of in some medical device spaces, and we really just hope it takes off and continues to grow.
Okay, so if I'm a product engineer, I'm launching a new product. I mean, there's a couple front doors here. I could be contacting FlexCon directly because
Yeah.
they saw some marketing and they're going to
Yes.
contact you directly, or they might either be an existing customer of a converter like TapeCon, or they find TapeCon's front door because they're seeing our capabilities in terms of some of the finishing characteristics that they found, and now they're going to back into, the right type of adhesive product. What do you
Yep.
think the questions that they might be asking, or the type of intake criteria that you'd want to have to, I guess, to properly either pick the right selection or just deliver the product the right way?
Yeah. So I will also say we truly value our converter partners, right, as extensions of our sales force. So first and foremost, thank you for even supporting FlexCon in that way. Yeah. So I think with FlexCon, we go about it in two different ways. We go about it from the OEM med device, and then we go about it from the converter space. And that's where I think you said we really are trying to show what the value is, because each customer is a little bit different. From a med device space, we have spoken to a lot of OEMs directly, where we want to understand their device and the wear time, right? So like, how long are you trying to keep it on the body for? What's it trying to do, and where is it staying on the body? Because in addition to OmniWave, FlexCon also has a really great line of skin-friendly adhesives that can keep it on the body longer. I say that because the original product that we've launched for OMNI-WAVE can last 3 to 4 days. However, if you need an additional backing with some of our Dermaflex products, you can keep it up to 21 days depending on your application. So I think what we're trying to understand is what's your wear time, what's your use case, and what is the patient going to be doing with this device. Then we traditionally just want to know sizes, right? We suggest a 1 by 1. I mean, ultimately, the bigger surface area, the better signal you're going to get. But or not better signal, but just more option for a signal. But we traditionally suggest a 1 by 1 square inch area. However, we have so many OEMs right now that are trying and configuring their designs in their own way. And that's honestly what FLEXcon value is as well, is to help you support that testing, help you get those devices out. If you're designing it a certain way, we've had so many customers pull up their CAD and say, okay, well, we're doing it this way. Here's the size. What do you think? And our R&D team is fabulous here that can come in and say, well, that looks good, but maybe consider wrapping OMNI-WAVE around the sensor, or doing it this way, and just providing a different consideration on how to design it in.
Yeah, and the question that I was going to ask in the very beginning, I was thinking about just because of your experience in med device, like just the submission process. If you're a med device company trying to get 510K type submission in, and you're trying to either do all the manufacturing yourself, that can be a pretty heavy lift. But partnering with a manufacturer that already has a credential, ISO 1345, and of course you had mentioned the 10993-10 on the material set, and the other standards. I think it was AMI, which I've never heard of, the AMI part. But I have to imagine that short circuits the submission process to get the device through the FDA, right? I mean, in terms of trying to go it alone.
Yeah, I mean, I think ultimately, right, we acknowledge that we are a component supplier and we have to provide you the data and the paperwork and the help to help you file it, right? But also the expertise that FLEXcon brings from the wearable side, right? I mean, I know a lot of people are designing devices and they might be more experts in the electronics or the hardware or whatnot. And we just bring that additional capability of considering, the skin time, the wear time, what kind of data we can provide to you to prove that and help you submit for 510K and CE.
Cool. No, that was great. No, I appreciate the overview. I was looking at your cut sheet here, and it's got the side-by-side comparison, like, neatly done in the chart of OMNI-WAVE versus hydrogel. So that's very referenceable with a lot of all the data from storage conditions to packaging, roll savings, and then, as you mentioned, the thickness difference. So that's it for OMNI-WAVE. I just had a question. Anything else? I guess I know FLEXcon's always working on something. So is there anything you want to share in terms of emerging technologies at FLEXcon? Anything that's happening under your watch in the healthcare division that's kind of new, exciting that you want to share?
Yeah, for sure. I mean, two things here. One, OMNI-WAVE is not a single product, right? We're not one and done. So you're going to hear it and you're going to hear about this product often. And we hope to have a cadence of launches, right? This is a platform, not just a single product. So though we just have a 3 to 4 day at this point, we're going to shoot for a long-term product that should be out by the end of this year. We're also working on a 10, so kind of a reusable, readjustable OMNI-WAVE aspect, and then a few more in the roadmap to come. And then also to complement that, right, OMNI-WAVE is one line, and we kind of view that as our diagnostics therapeutics line. We also have a really great Dermaflex line. Dermaflex is kind of our wearables line. And we are working to really innovate in that space and hear from med device creators, what devices are they creating? What materials are they looking for? Where is it going on the body, so that we can innovate from an adhesives and materials standpoint on that aspect as well. So I mean, honestly, I just hope FLEXcon's an awesome place, and I hope that we can grow healthcare together. So
Cool. Well, thank you. Is there anything else? I guess that's it. It's all she wrote. But is there anything else you want to add, or any final comments or thing you want to mention before we wrap it?
I mean, just keep us in mind. I think that's one of our biggest hurdles right now, is that people don't recognize that FLEXcon even has a healthcare division. So we get a lot of customers saying, oh my gosh, we can buy this from you. We don't have to buy it from XYZ. So really just getting our brand name out and recognizing what we can do for the med device companies.
Cool. And for those listening and or watching, this is FLEXcon employee number 2, because we did have an earlier podcast with Bill Sullivan earlier. So on the website, you should be able to go back and see that first FLEXcon interview. So, Well, Aditi, thank you so much. Thanks for being on the podcast. And I'll talk to you, see you around the block and talk to you soon. Thanks again.
Absolutely. Have a
All
good
right,
day.
see ya. The Better Products Podcast is about educating product teams about new materials and new technologies, all in the custom material converting and printed electronic space to help them design and build better products. So in this podcast, I'm hoping to get wide-ranging conversations with various people throughout the industry and just bring a lot of good content to the table. So if you're interested in learning more about the industry, materials, processes, how to improve products if you're on a product team, or just general know-how of what the heck is going on in this industry, then subscribe to the podcast and get ready for some more really good episodes as I bring in some great guests. Thanks.